Good morning. I'm Mike Neal, President and CEO of the Tulsa Regional Chamber. Thank you for joining us for today's Business Support Series webinar, actually episode 16. The Chamber's Business Support Series offers insights on how your organization can effectively respond to the pandemic. We are excited. We've had great success with these webinars in the past. So if there's an area at all that I or any member of our team can be of assistance to your company, please let us know. Today's discussion is about herd mentality in the COVID-19 pandemic. Herd mentality is an individual's tendency to follow along with a larger group. In many ways, it's a positive feature of our species, but in other ways, such as the current shortage of hand sanitizer across the nation, it's a fault. But before we discuss this topic in more details with our keynote speakers and experts, I'd like to thank the Business Support Series sponsors. You see them listed at the bottom of your screen: Expert Ready, Luxa Enterprises, Security Bank, and Stride Bank. And we're pleased to have with us Carmen Cavanaugh, Project Manager at Expert Ready, to introduce today's speakers. Carmen, we'll toss to you.
Thank you so much, Mike. It's an honor to join everyone today, and I'm so excited to introduce to you our speakers. Amy Ratliff is Vice President of Human Resources for Arrowhead Consulting, a firm that provides support in project management, leadership development, organizational effectiveness, and more. She has more than 26 years of experience in human resources. Dr. Rebecca Hubbard is Director of Outreach, Prevention, and Education for the Mental Health Association, Oklahoma. The association is a statewide organization committed to promoting mental health, preventing suicide, reforming criminal justice, and ending homelessness. Thank you both for joining us today. Please share with us your perspective on the pandemic, herd mentality, and how each has affected your work, starting with Amy.
All right. Thank you, Carmen and Mike and the Tulsa Regional Chamber for having us today. We're going to talk about where's all the toilet paper, how herd mentality affects behavior and mental health in a crisis, in times of crisis. So we can move to the next slide. So as Mike mentioned, herd mentality is a tendency for people's behavior and beliefs to go along with the crowd or to conform to a group in a way that they might not normally behave. And I think we saw evidence of that as COVID-19 began to permeate America. And there were times that people might have been in the store and thought, well, I probably have plenty of toilet paper, but these people must know something that we don't know because they're buying all the toilet paper, so we better get toilet paper as well. So when individuals are affected in that way, they are behaving in a much more emotional way than they are in a rational way. And so we can move to the next slide. That incites usually panic buying, where people think that things are going to run out, and it's highly driven by fear, and fear of not being able to take care of themselves or their families. And so that fuels anxiety and brings people to a place of high stress. And I want to talk for a little bit about how that affects businesses and employers. And many of you on the call own your own business or have a business and have employees that report to you. So on our next slide, we talk about how this is really affecting your employees. So we have a morning call every day at Arrowhead Consulting, and we talk about what we accomplished the day before and what we intend to accomplish later today. And several clients are doing the same thing. And I had a woman tell me a week or so ago, she had to fake like her camera was malfunctioning because all of her team, she could see everyone on the Zoom call. Everyone seemed so, happy and chipper, and like everything was fine. And she has 3 little ones at home that she's trying to manhandle in the morning and get food ready for, and 2 dogs, and spouse also working from home. And it was so overwhelming that she started crying. And so she quickly turned her camera off and felt like They'd already had layoffs, and she thought, if they don't think that I have it together, then I could lose my job too. And that is pretty concerning because 51%, as you'll see on the slide, of employees feel like they have to say that they are always or very frequently acting as though they're happy when they're not. And so, to give you a little dollar statistics behind that, each year, stress in the United States costs employers $500 million, and that's per year. So to compare that, I've been writing a blog about Star Wars, and the entire Star Wars series, the whole franchise, all of their movies, videos, everything, has totaled $9 billion in total. So $9 billion total for Star Wars. 500 billion per year is what stress causes employers in America. And I thought that was pretty overwhelming statistic in and of itself. So most managers wish that their employees would talk to them about their feelings and what's going on with them. And I'm going to turn it over to Rebecca, who will give us some tips on how we can create safe space and help employees with their mental health during times of crisis.
Thank you, Amy and Carmen and Neil and the Chamber. Appreciate you allowing me to be a part of this today. I hope it's very helpful for those of you that are listening. Yes, COVID-19 has had a very significant impact on our mental health globally already. Our baseline anxiety has risen just because our brains have a natural instinct when we recognize a threat to ourselves, we fight, flight, or freeze, right? And so we have this kind of threat to ourselves with this disease. And so we are kind of in a chronic stage of fight, flight, or freeze, and trying to carry on with the normalcy of work and managing families and getting groceries and toilet paper, right? And so with that baseline level of anxiety and the fact that we're living in historical times of trauma, we're going to see heightened symptoms and maybe new symptoms of depression, anxiety, trauma responses, maybe startled or overwhelmed easily, not sleeping well, acute stress, and unfortunately, suicidal ideation. That's why right now connecting is more important than ever. Additionally, in the workplace, this is one of our biggest places of connecting. So we want to be really mindful of mental health within the workplace. And it's really pretty simple. It's about just making those genuine connections and offering opportunities to express themselves. One of our wonderful corporations here in Tulsa, I heard through the grapevine, is asking all of their staff, in a word, describe how you feel about the COVID-19 pandemic today, and how secure do you feel with your support network during this time? What a wonderful support to their employees' mental health. I love being a part of the association because, of course, we're very mental health aware, and we have the opportunity to do yoga and they've even taken that online for us. And I'm so grateful that they're mindful of the needs that we may have for our mental health. I'm also making sure that you allow mental health days. If people need to take PTO for their mental health and well-being, being supportive of that is huge. And the reason that's huge is because just what Amy shared is it will actually increase your productivity and your corporate growth. I want to talk a little bit about herd mentality and mental health and what it looks like physically and mentally and in productivity. If you have an employee that might be not showing up to work or showing up late, feeling overwhelmed, seeming overwhelmed, they may be struggling with some depression or some anxiety. If you have someone that seems heightened arousal and more stress than normal and maybe a little sharper in their tone, they may be experiencing some heightened symptoms of anxiety or trauma. It's very important to be mindful of these and make genuine connection with them to see how they're doing, encourage them to reach out to employee assistance if you participate in that program, or access some of the many resources we have available here in the Tulsa area. And again, just to drive home the point that Amy made and what I'm trying to back up with mental health awareness and understanding is that actually, you know, productivity is highly, highly linked to the mental health and well-being of the culture of your place. And yeah, so that's it. Thank you so much.
Well,
I'm gonna
thank
turn it
you.
back to me.
Amy and Rebecca, we sincerely appreciate you. Both got us off to an excellent start. We will not have the ability to take live questions on this webinar, but we do have some questions that have been submitted ahead of time that I'll ask both our guests. And we'll begin with the first one. Really has to do, and you both touched on the herd mentality. But if we could, what are some aspects of herd mentality that you've seen during this pandemic?
So from a positive perspective, I've seen things like challenges on social media, whether it be business resiliency or workout challenges. A lot of places have challenged folks to take advantage of free workout. You'll see bears or rainbows in houses' windows for kids to go and do scavenger hunts throughout the neighborhood. And so there have been a lot of uniting. There's positivity challenges where people are having others nominate each other at work and through social channels. So those are some of the positive aspects I've seen.
Thanks, Amy. Rebecca?
So we definitely see positive and challenging aspects of herd mentality. Obviously, you know, we mentioned the overbuying. We've also mentioned, well, we haven't mentioned actually some of the unfortunate kind of differences we have about wearing masks and maintaining physical distance for health. So that is a particular area that as mental health professionals we're concerned about because, and as medical professionals, because of the physical health aspect, of course, the risk is still the same for infection, even though we've opened the state. It's just that we're prepared to handle it when infection does happen. So we still want to minimize that infection. And as part of that, we need everybody to have that herd mentality of supporting and taking care of one another by washing their hands, wearing their mask, and maintaining a safe distance in a positive manner.
Thank you. What can business managers and owners do to promote healthy practices as we begin the process over the next few weeks and months of returning to the workplace? What suggestions or tips do you have on half of them in that regard?
Yeah, so I would just continue on with, you know, my examples about the corporation that was very intentional about connecting with and asking. You know, a lot of times we just forget to ask those simple questions of how are you really doing, and wording it in a way that's not broad but very specific, so that you can get a direct answer and really know how your employees are doing. And also those opportunities, like we've mentioned, to do yoga or meditation. I was talking with someone that was on the Tulsa Police Department for several years a couple weeks ago, and he said that they have like a swing hour where they can work out or whatever, but it's their time during their shift to take care of themselves. So if we can kind of garner that mentality for each corporation that we're leading and encourage people to take that time to take care of themselves, that's going to be hugely helpful.
Thanks, Rebecca. Amy?
So I think that having a trusting and safe place, like Rebecca talked about, in the workplace is important. It's hard for people to be vulnerable in the workplace. People don't want to seem as though they're weak or that they have some sort of personal issue that they're dealing with. And so they are, in a non-trust environment, very hesitant to share that. So I think that companies giving employees an opportunity to maybe have a board or a wave through social media that they can express those anonymously if they're not in a high trust environment, or companies can really start working on how to build trust and cohesion in their team so that they have a more trusting environment to be able to share, because you don't want people to kind of be putting on that fake smile when that's not really how they feel.
Right. Thank you. Thank you, Amy. Thank you, Rebecca. We chatted a little bit in the beginning about sort of positive aspects of the herd mentality. Let's transition to the other side, and that is, what are some tips that that business owners and managers can use to avoid into the negative herd mentality trap.
Rebecca, you want to go?
I was waiting to see if you were going to go. I think for business owners to avoid the herd mentality, it really comes back to just setting principles in your corporation that protect the individual. If we are thinking of the individual, then as a herd, we are going to act in a way that is protective. If you think about elephants and lions and those type of animals, they protect, right? They come around the most vulnerable and they protect to the death those most vulnerable. And as a corporations, we can come around, as people in corporations, we can come around our vulnerable, we can come around those that might be overwhelmed, and we can protect them by just being genuine, offering grace, and grace may look different to people, right? So for me, we took a lot of support groups online when we went to remote working, and that's only a portion of my job, but it became a whole full-time job in and of itself on top of everything. And my boss literally called me about 3 or 4 weeks in and said, you have to take a day off. You have to. That was grace to me, because I will go. And to have him insist that I take a day off was grace. And it was exactly what I needed. So learning and knowing about your employees so that you can focus on them as individuals will lead that herd mentality to better health and wellness.
Great counsel. Amy.
So I think that staying in the negative leads people down a victim mentality road, and that is not healthy for anyone in the workplace or at home. And so anything that you can do where you are talking about what you can control, a lot of people tell themselves lies. So you should probably talk to yourself more than you listen to yourself. I learned that during quarantine on a training that I was involved in. So what lies are you telling yourself, and what truth do you need to replace that with? So keeping on a positive side, because if you stay churning in that negativity, it's not only going to keep you in that victim mentality and that type of negativity space, it will keep you from being able to move forward. If you're practicing gratitude, it's basically impossible to be stressed, angry, and frustrated when you're in a mindset of gratitude. So thinking about all the things that you can be grateful for, you're healthy, you still have your job, or your home. So focusing on the positives, I think, is going to be key.
You ladies are so good. I'm so impressed with both of you. I'm so impressed with how you address this and how you counsel folks to respond in this fashion. So my hats off to both of you. Thinking a little more broadly now, what are some other social behaviors like herd mentality that businesses should consider when managing a workforce, and certainly when bringing a workforce back into the office?
You want me to go first, Amy? Okay. The first thing that I would start with, I sit in on the COVID updates 2 to 3 times a week from the state physicians, and they are still emphatically trying to encourage that we practice our engagement with others in a very safe physical way. So incorporating whatever the CDC, Oklahoma State Department of Health, or Tulsa Department of Health is encouraging you to do as a corporation. And they know that you're wanting to keep them safe and healthy. And additionally, I think, again, just adding those parameters. I love what Amy said about, replacing the negative with the positive and having that positive leadership too. You may be struggling. You might be concerned about the bottom line, right? You might be overwhelmed and thinking, are we going to make it through this? And just being able to do that little process that Amy shared for your own self. Because when you think about it, when we're leading, the people we're leading take on our emotions, they take on our tenacity, they take on our excitement. It's all very contagious, whether it's negative or positive. So just making sure that you're taking care of yourself too, so that you can be a positive leader and healthy as you lead your corporation.
Great. Thank you, Rebecca. Amy?
So I would close it out to say, I don't want us to move from a herd mentality standpoint of now acting like, oh, well, everything's fine. We're back to work and restaurants are open and now I don't need to wear a mask and I'm good. Because when this all first started, I think when people would bring groceries home, you were Clorox wiping every last thing that came into your house and taking a shower. And now we're just getting in the car and going back to work. And I think it's very easy to forget about how we need to behave in this new normal. So I would say if we are going to move from a herd mentality, be that difference where you're reminding your coworkers about safe social distancing and washing your hands and keeping things intact. So,
Thank you. Thank you, Amy. Rebecca and Amy, as I make CEO calls for a living. So I'm on the phone constantly with CEOs of all different size businesses. But the consistent thing I've heard, really, especially the last 2 weeks, as there have been this public debate on when to reopen the economy. You had the president saying one thing, you had governors in all the different states saying something, you had mayors in kind of different cities saying different things. And so you had just the general nervousness of everybody. Certainly when you turn on the national news and you get all your news, all your tweets and everything on your phones, people are scared. And so as I've talked to these people, one of the things they've said is that as we've talked to our employees, about half our employees are chomping at the bits, ready to get back in the office and get to work, whereas about the other half of them are scared to death and are saying, hey, can I just work from home for the summer? And so they seem to, we seem to be hearing that about 50% are ready to go and about 50% want to stay, are really leery and want to stay as far away from the office as they possibly can. What thoughts or ideas or tips do you have for leaders who are trying to manage that type of diverse workforce with those different sensitivities?
I can go, Rebecca. I think if you're able to accommodate it, and I think this can be useful even in non-COVID times, there are times that flexible work environments and flexible hours can be good for people and their families and for their mental health. So if you're able to allow it, then I think it's something that companies should consider. I do think that getting the economy going and open in a safe way is important as well. I mean, the new news out today, 32 million Americans filing for unemployment last week. So obviously that's a huge number and a huge impact on our nation. So if you are able to allow or accommodate or allow people to switch shifts or ways to do that, I encourage that. If you have to, maybe you're a manufacturing environment and you have to have very close employees and they're working on the line, everything that you can do to take their safety into consideration is something that we should be doing. Making people feel like they should come to work when they're sick is a dangerous game for us to take into our hands. So I think if you're able to do it and can accommodate it in a safe way, then that's the best way to go. But otherwise, making sure that you are providing them with the equipment that they need to work safely.
Thanks, Amy. Rebecca?
Yeah, really the only thing I would probably add to that is look at their productivity. If they want to stay home and work, and was their productivity higher in the last 5 weeks or 4 weeks that they've been home, then please consider that. Please consider that maybe they will actually be more productive by staying at home and doing work. And it doesn't have to be a final all forever decision. It can be a temporary, let's reevaluate in 30 days or 60 days. But it shows them that you value them, that you see their productivity, and you see them as a person. And I would venture to bet that if I was a betting girl, that you would continue to have very positive productivity out of them if they're wanting to stay home. And if they're wanting to come back again, I wholeheartedly support what Amy said about keeping it safe.
Thanks.
Many
Thank you,
people
Rebecca.
have put in
Thank you,
more
Amy.
hours. Many people have put in more hours lately than they do when they're actually at the office.
And I think we've all been astounded by the productivity of our staffs and really the productivity of much of the workforce in being able to work remotely. And I think so many people have been extraordinarily productive. we don't have but 5 minutes remaining on our webinar, and so I want to pass it over to Carmen Cavanaugh for our final question.
Thank you so much. So you guys touched a lot on all of the anxiety that this pandemic has caused. Do you have any specific resources or practices that you feel employers should really consider for their employees and for themselves?
The Mental Health Association definitely has resources, as does online. The Mental Health America has incredible information. Child Mind Institute is almost daily. If you follow them on Facebook, if you have children or you have employees that have children, they give great tips and information from top-notch psychologists and psychiatrists in the country about children and the situation and their mental health and well-being. But the Mental Health Association, additionally, locally, as I mentioned, we took our 12 ongoing mental health support groups online. And so that's for people who were struggling with depression, anxiety, bipolar disorder, post-traumatic stress disorder, or if they've lost a loved one to suicide or a violent act. And then we have one for parents who may have a child or an adult child with a mental health disorder to come in and support one another as well. Additionally, we added COVID stress management related support groups, 13 more of those. And I think we've added even a few more after that. So we have some for first responders because we know that they're answering a big call in taking care of all of us during this time. One for frontline workers. So those would be nursing home workers, homeless shelter workers, grocery workers, people who have had to continue to work and continue to be integrated with people in a way that they're feeling heightened stress because of the risk to their physical health and well-being. And then many to the general population, including specific ones for people who have maybe trauma in their history, or they're a parent that suddenly, making sure their kids are doing school at home, they're working from home, and they're suddenly parenting 24/7 and can't even go to a park to run off all this energy with their kids. We have a couple of those available as well. We also have our mental health assistance center. So if somebody does need to access services, our mental health assistance coordinator is phenomenal. She knows about information all across the state and can help people navigate and get to the resources that best fit them to help them in that process. But of course, again, meanwhile, just general mental health and well-being, Mental Health America and Child Mind Institute are wonderful resources.
Thank you, Rebecca. Amy.
So I would encourage executives and leadership as well as HR departments to really lean into their company employee assistance programs. Those are also, in addition to all the great resources that Rebecca mentioned, critical during this time. A lot of employees feel like that someone will know that they've called the EAP, and that's definitely not the case. So embracing programs that organizations offer, maybe bringing in-house or having Zoom video calls and bringing in your EAP provider, they are more than happy to do that. I know Community Care and other EAP providers locally are happy to offer those type of services virtually. So definitely make sure you take advantage of that.
Well, thank you so much to Amy, Rebecca, and Carmen for joining us today. Again, I'd like to thank Expert Ready, Lux Enterprises, Security Bank, and Stride Bank for their support, their ongoing support of this series. Anyone who came in late or called in by phone and would like to share this webinar, a recording will be posted on the Chamber's website later today. Also later today, the Chamber will host renowned author and urban studies theorist, Richard Florida, for a virtual talent strategies symposium on post-pandemic recovery. Richard Florida is an amazing presenter. You will not want to miss him this afternoon. Likewise, our next business support series webinar will be next Tuesday, May the 12th at 11 a.m. with Rachel Hutchings, Executive Director of Workforce Tulsa. Then on Wednesday, May the 13th, we'll host United States Senator Jim Inhofe for a virtual congressional forum at 2 p.m. You can register for both events, both virtual events at tulsachamber.com/events. Advanced registration is required for both, so I would encourage you to do so. Also to help businesses that are reopening to do so as safely as possible, the Tulsa Regional Chamber has compiled an open for business guide, which incorporates best practices from national, state, and local authorities. That guide is available now on the COVID-19 resources page on tulsachamber.com. We've released that a couple days ago. We've tried to disseminate that in the media and in social media. So we'd encourage you to go to that. We've had great feedback. I compliment our team for the work they've done in that regard. So we encourage you to go reference that guide. Feel free to share that with staff. Feel free to share that with other business owners and managers across our state and across our region. And again, please don't hesitate to reach out to this chamber staff or to me personally if we can be of assistance to you or your company in any form or fashion during this pandemic. Thank you again for joining us today. Thanks once again to our sponsors, as you see displayed at the bottom of your screen. Hope everyone has a fabulous afternoon and a great long Mother's Day weekend. Have a great one. Thank you so much.